Alright, hey guys, it is Angel Savage. I just got done with the job interview. If anybody is wondering, like, why the heck does this girl have on a full-blown suit? I'm actually going to take this suit off because I feel like I look so formal and I don't know if I like that. So, yeah. Anywho. So, I went to the doctor's this week to go talk to my doctor about some of my health concerns. And so I'm not going to share everything with you guys about my health, but I am going to share with you guys something about, well, I don't even know how to say this, so guess I'm just going to come out and say it. Apparently, I'm depressed. Let's just come out and say it. I am battling depression. I have been battling depression probably since the 3rd grade. And I know you guys are like, whoa, what the heck does a child have to be depressed about? But I was officially diagnosed with depression, I think I was like 15 or 16. All my life I've been an athlete, so yeah. I know you guys are like, what does that have to do with anything? Let me get to the point. Went to the doctors and I was diagnosed as being anorexic. Let's get this clear. There's a huge difference between people who are bulimic and anorexic. People who are bulimic are intentionally causing themselves to become skinny or malnourished or whatever the clinical term is for that. I was diagnosed with an unintentional disorder. I guess you could say maybe because of my depression. So the official name for it is Anorexia Nervosa. Yeah. So what are the things that we need to know about anorexia nervosa? What is anorexia? Anorexia is an eating disorder that can lead to severe weight loss. Anorexia may cause you to stop eating or to eat fewer calories than what your body needs. The weight loss is not related to any other medical condition. What increases my risk for anorexia nervosa? Anorexia most often starts during teenage years. The following may be increased due to things of wanting to have a desire to be perfect in everything you want to do, participation in sports or activities that require low weight, constant eating to lose weight, constant dieting, to lose weight, a family history of an eating disorder, trouble accepting how your body looks, pressures from others to be thin, okay, and a recent loss or separation. What are the signs and symptoms of anorexia nervosa? Okay, so some of the signs include body weight that is much lower than your healthy weight and height proportion rate, fear of gaining weight even if you are very thin, spending much of your time thinking about food and how to lose more weight, restricting food, measuring or weighing everything you eat or not eating at all, eating large amounts quickly, and purging, vomiting, or using laxatives to prevent weight gain, exercising too much to prevent weight gain, feeling tired, dizzy, weak, cold much of the time, cracked, dry, thinning hair, fine hair covering your body, nails break easily, mood problems such as easily becoming angry or depressed. Okay, so how is anorexia nervosa diagnosed? So the way that, if you guys are curious, how is it diagnosed? Your healthcare provider will examine you and check your height and weight. Blood tests will show if you are getting enough iron, calcium, and other nutrients. Urine tests may be used to check signs of dehydration. Your provider will ask you, how do you feel about your body? how you control your weight. The provider may ask you to fill out several forms about feeling and eating habits. You may have a hard time talking about your weight or about not eating. You may also have trouble asking for help. Your healthcare provider asks these questions that are only meant to help you. Okay? The more honest you are, the more easily the healthcare provider can help you become more healthier. Okay? Got to be honest. How is anorexia nervosa treated? You may feel like it's hard to get better, and you may have a lot of feelings about eating and reaching a healthy body weight. The treatment is only meant to help you develop a healthier relationship with food. Treatment can also be needed for health problems caused by anorexia. Treatment may need to take place in a hospital or a clinic. So this can get pretty serious. Counseling. Okay, so how is this treated? Okay, there's 3 ways that they go after this. The healthcare providers will go after this. The first way is counseling. Counseling is an important part of treatment. Okay, you may want to work with your healthcare providers alone or in a group. Group counseling is a way for you to talk with others about your anorexia. Counseling may center on helping you replace negative thoughts with positive thoughts. Family sessions can help everyone in the family understand the anorexia and what to do to help you. Nutrition therapy. So nutrition therapy means you will meet with a dietitian to help you create healthy meal plans. Others in your family may also meet with the dietitian. Your healthcare providers and dietitians will help you to make small changes over time. Medicines. Medicines are sometimes used to help anorexia or the problems that it causes. You may get medicine to help you improve your mood, control your mood swings, decrease obsessive thoughts. Vitamin or mineral supplements may be needed if the nutrient levels are low because of your anorexia. Okay? So, what can I do to care for myself? Be patient. Recovery from anorexia is a process that takes time. And you may have time to when you go back. What can I do to help myself? Be patient. Recovery from anorexia is a process that takes time. You may have times when you go back to not eating or eating few calories, especially in stressful times. This is common. Work with your family members and healthcare providers to get back on track with healthy eating and healthy exercise. Try not to be angry with yourself for the episodes that you'll be having. It might help to talk about your feelings with someone you trust. Focus on healthy self-esteem. Think about everything you like about yourself. For example, you may be a talented artist, or you may write well. Focus on those skills or talents instead of on your appearance. Ask others not to comment on your weight or shape. Your healthcare provider can tell you a healthy weight ranges for your body and height. It may take time for you to be comfortable knowing your weight or seeing your weight is healthy. Remember your goals to build high self-esteem. Be patient with yourself, as everything takes time to change your thinking process. Where can I get support and information? Alright, so these are a few places that my doctor gave me. I don't know why she'd give me some places out of state, but she did. So where can I get help and more information? National Eating Disorder Association, which is located at 165 West 46th Street, New York, New York, 10036. Phone number is 1-212-575-6200. Another number that they can be reached at is 1-800-931-2237. web address is www.eating. I just lied to y'all. The web address is www.nationaleatingdisorder.org. All right. I leave the information down below as well for others who may be in New York or just anywhere in the world, and maybe these facilities can help you find somewhere locally. All right. So another place is the National Institute of Mental Health Public Information and Communication Branch, which is located at 6001 Executive Boulevard, room 8184, MSC 9663, Besada, which is spelled BETHESDAMD. So I guess it's in Maryland. And the zip code is 20892. Phone number that they can be reached at is 301-443-4513. Another phone number that they can be reached at will be 866-615-6464. And their website is www.nimh.nih.gov. So call 911 for any of the following emergencies. Anyone who wants to harm or kill themselves. If you want to harm or kill yourself, you need to call 911. Okay? I'm just going to put that out there. If you have pain when you swallow or severe pain in your chest or abdominal area, your heartbeat is going faster or fluttering, or you may feel dizzy and faint, you need to call 911. When should I seek immediate care? Your muscles feel weak and you have pain and stiffness. When should I contact my healthcare provider? You have tingling in your hands or feet. Your monthly period is light or has stopped completely. You are planning to get pregnant or need to develop a safe eating plan. You have questions or concerns about your condition or care. I thought my camera's gonna stop. All right. To help you have the right to plan your care. Learn more about your condition and how it may be treated. Discuss treatment options with your caregivers to decide what care you can receive. You always have the right to refuse treatment. The above information is an educational aid only. It is not intended as medical advice. For individual conditions or treatments, talk to your doctor, your nurse, your pharmacist before following any medical regimes to see if it is safe and effective. Okay, so I'm just sharing with you guys some of my information that I was given pertaining to my condition. Now I am going to briefly go into my condition. I always thought I was healthy, you guys. Like, seriously, I always thought I was healthy. I have done sports my entire life. I'm telling you guys, since I was probably like 2 or 3, I've been involved in gymnastics, track, cheerleading, karate. I even thought I was a ballerina for a moment. I've been involved in sports heavily. I would say the reason for this concern, I had some issues with my heart. And it's completely normal I did my EKG and everything, but people who are, from what I'm told, at a lower body weights, it's very rare, but for me, what caused the doctor to be alarmed of this was an irregular heartbeat. So I also expressed to her that I did express to my doctor that I was depressed. I think personally I have a lot to be depressed about, but I have gone to therapists in the past and they told me that I have to get with my healthcare physician in order to help this. So I have been going to counseling in the past, dealing with self-esteem issues, not necessarily body weight, I guess. But I'm just going to tell you guys some of the symptoms that I go through, and maybe you guys can relate and not feel so ashamed about your condition, or if you think you might be someone dealing with this condition. So right off the bat, things that I noticed for me, which may have been a risk for increase, a desire to be perfect in everything you do and how you look. I would say that I'm very hard on myself, and I am a bit of a perfectionist. And as far as my career goes, when things do spiral out of my life, I'm all the way bad. Like, my organization is bad, my room might be dirty, I might not want to get out the bed, I might not want to do my hair, brush my teeth, wash my body. Okay, that's really embarrassing to say. Yes, it is. But these are the conditions that people go through when they're dealing with depression. So, am I ashamed? No. I'm hoping that me being honest with people, this will help other people. Okay, being a female. They say just being a female. Having a family history. My mom's not anorexic, but I definitely think that my aunt is anorexic. She might cuss me out for saying this, but good thing I'm not saying her name. She's like maybe 90 pounds, if not that, maybe less than. Pressures to be thin, or trouble, I would say for me, trouble accepting my body, trying to be perfect. Those are my two main things. In today's world with social media, it's just not ideal. It's just not ideal, the measurements that they want girls to be, or that we strive to be, like trying to have this perfect body. Like, it's so hard that it literally kills people, and I literally mean it kills people. You go on Instagram and you see these girls with like all these fake bodies, and you're like, okay, will I ever grow boobs? You know, and I've tried everything. Like, I've even tried Bella breast cream. I've tried glute boosts to increase my butt. I became very obsessed with working out and not eating appropriately. Something else that I went through a tragic loss of a relationship. I was in a relationship with someone for 3 years, and he lied to me every day for 3 years, and then we still messed around for an additional 2 years, I would say. From the time that I was 19 up until me being 24. So 19, 21, 22, 23, 24. And I'm about to be 25. So we can honestly say like 5 years. I dealt with so much with him. But that's not what this video is about. So you can only imagine the stress. Like, I'm telling you, I went through a lot. It was even abusive. I just wanted to be perfect, and I kept on trying to be perfect and wear my hair this way, or, you know, not wear sweats all the time, because I'm a time girl. You know, I did sports. I was running track, so I wore sweatpants a lot. He didn't like that, so I started dressing up more. You know, you think you're doing this for him, and then you realize little by little you're changing yourself, and as you change yourself, you're changing the way your self-esteem is set up. And it's very sad, because I made all these changes to be I'm sorry, trying to make sure I'm still recording. I made all these changes to try to be a better person, and yet and still we're not together. So yeah, it sucks, and I totally get it. I do. I get the pressures of, you know, I deleted my Instagram because I felt like, oh my God, like I had like over, you know, just about 10,000 followers, and I deleted it because I felt like I can't do this anymore. Every time I'm looking on social media, like, I'm reminded, like, I may never have breasts, you know, or I may never have a large derriere, or I may never have this body, because these girls are not even being honest about the fact that they're getting surgery and then they're going to go work out to maintain it, and making it seem like, you know, I worked hard to get here. That's not the case. You know, or just dealing with the fact that, you know, girls who have more voluptuous bodies, they get more attention. And, you know, I also dealt with, I've always been skinny. Everyone in my family is pretty skinny. I mean, they're kind of shapely, but for the most part, like, we're pretty, you know, fit, muscular people. So, you know, obesity doesn't run in this side of the family. I say people are pretty thin. You know, you have your rare case in my family where people have big booties and boobs, but my mom's not that person. She's a very petite person. Same thing with my aunt. So who's to say, you know, if my aunt's really anorexic? But, you know, it's a lot. It's just a lot being a female. And maybe even if you're transgendered, you know, you're going through a lot, even probably more being transgendered and going through this because you're dealing with, you know, being transgendered and everything that comes with that. And then, you know, being transgendered has to be hard because you feel like, you know, for a fact you're a woman on the inside, but on the outside it doesn't resemble that. And so physical appearance, trying to stay thin or not to be too muscular looking like a guy, or hormonal shots, who knows. But I'm just here to let you know that I understand. I totally get it. Not only that, like, I was a stripper. Yeah, I was a stripper. And being thin and not having a fake butt, fake boobs in the strip club, it's very hard mentally. Like, it's super duper hard because, you know, you have everyone saying, girl, you need to eat, you need to eat. And then it's like, you hear this your entire life. You know, you hear like, oh, you need to eat more, you need to eat more. And it's like, I'm eating, like, gosh, like, get off my back. Like, I'm trying to eat. Like, you know, you sit down for a meal and you try to complete a whole meal. You can't complete a whole meal. And it's like, my body's just not set up that way. And then you're trying to force yourself to eat. And it's just like, you're not able to take all the food. Like, and it hurts. It truly hurts being told constantly, especially by family members, because this has happened to me before. Oh, you're anorexic, you're bulimic, oh, you're too skinny, you're this, you look like one of those kids from Africa. Like, oh my gosh, like, how could you guys be so hurtful? You have friends who say this, you have family members, you have random people who say this to you, and it's like, I'm trying as hard as I can to get my life how, you know, I see it perfectly. And it just hurts because it's like, you have these people constantly in your ear, and it's like, bro, don't you think I wish I could complete a whole plate of food? Like, you don't think I want to eat all my food? You know, or people will play you and they'll give you less food. And you know what I'm saying? Like, they do shady things, or they'll give you, I know this is me probably sounding ungrateful, or they'll give you more food and trying to be slick and say, oh, girl, you need to eat more. I put on a couple extra potatoes, when in all honesty, it's not that you don't want to eat. It's that you don't have the energy or the metabolism to the appetite to complete all this food. So sometimes I just want to go, ugh! And I just want to like get really mad at people because it's like, I'm doing everything I can. Okay, recompose myself. So for me, it's actually not fear of gaining weight. I want to gain weight. Like I've always said, I want to be a little cute pudgy girl with love handles. So for me, that's not actually the situation. The situation for me is that I just don't have the appetite. Like, I don't have the stamina, like, to finish this food.